Medicaid fraud is exploding across the country, and a new investigation found it's also becoming a payday for private consultants. Federal auditors flagged more than $1.5 billion of improper or unsupported school-based Medicaid claims just across 4 states, while the private firm helping label those services made more money as the claims grew. Well, joining us now to break it all down is Deputy Public Policy Editor at OpenTheBooks.com, Rachel O'Brien. Good Friday morning. You know, this sounds less like health care and more like a commission plan. All of this discovered during that federal audit of Pennsylvania, New York, New Jersey, and Michigan. How did this work, Rachel, and who was supposed to be watching the money?
Yeah, so what happens is schools can bill Medicaid for health services that they deliver to kids. So speech therapy, nursing services, counseling, and school district employees, they code services as Medicaid or not. And a percentage of their staff salaries get paid for Medicaid. So as you said, in those 4 states, we saw they hired this company to do the coding. It was Boston-based. They're called Public Consulting Group. So they did this for those 4 states. And there were multiple audits, federal audits, that found that this firm got paid as the federal claims increased, right? Makes sense. The more money they're able to get, the more money they get. So a lot of this was flagged as improper. In New Jersey, $607 million was improper, $551 million Pennsylvania, $439 million New York, and just under $1 million in Michigan.
Gosh, that's so much money. What are some of the examples of services they coded as covered by Medicaid?
Yeah, so in New Jersey, auditors found 235 instances where the firm improperly altered the school employees' responses about the work they were doing. So they lied about what exactly the services that were being provided. So for instance, a school social worker would log a parent phone call as social services, but that response would be recoded as a Medicaid health service, even though it wasn't. So we saw a lot of that. And you can see how these numbers went up under a prior contractor. In New Jersey, school staff spent about 16% of their time on direct health services. Once they switched to this firm, Public Consulting Group, the figure rose to 62%, right? So clearly, school staff couldn't be possibly spending that amount of time on Medicaid reimbursed services. New Jersey, same thing. The firm was padding Medicaid invoices with pension costs. So even though New Jersey hadn't been funding their pensions in the time that this audit covered, the firm was including pension costs in these Medicaid invoices. Pennsylvania, similarly, the firm didn't ask enough questions of employees to find out whether they actually were performing Medicaid eligible healthcare services, but they were billing for them. A speech language pathologist working on English language arts curriculum goals, that was coded as delivering Medicaid services. So we just see time and time again, they're just miscoding these services to get more money.
Well, it sounds criminal. Like there should be some further investigation on these private companies and how they become so embedded in government that it ends up policing itself. So states were told to return hundreds of millions of dollars. Have they?
No. So the Inspector General recommended that Pennsylvania return $183 million. There was another $369 million where they gave the state a choice to either prove that the claims were valid or to refund that amount too. And Pennsylvania didn't. New York also told $98 million, give that back, or give back another $341 million again if you can't prove that it wasn't fraud. New Jersey, they said give back $301 million. Now, the states and the consultant did dispute some of the findings, and shockingly, so far, no state has refunded the most of these recommended amounts. Yeah. So, like you said, we've seen this instance, consultants get involved. They bilk money from the safety net, and they look to just profit themselves.
And we're all paying for it because these are federal funds. All right, Deputy Public Policy Editor at OpenTheBooks.com, Rachel O'Brien, thanks for joining us on this Friday.
Thanks for having me.